Thank you. So today we have 6 new cases, all overseas acquired and in hotel quarantine. That brings us to active cases in Queensland 41. I want to thank all the Queenslanders who have come out and got tested over the last 24 hours. We've had over 10,173 tests, and I'm very pleased that we've had 3,313 vaccinations in the last 24 hours, which means that we are seeing the number of vaccinations per day escalating as we bring more sites online. So that's really great news. Other positive news is that with all of the tests we have done so far in relation to the PA and the Hotel Grand Chancellor, that all of those results have come back negative so far. And of those, so we've had 428 close contacts of the PA doctor. The results we have back so far, 77% of the results all show negative. Of the staff that have been close contacts and have all come back negative at the Hotel Grand Chancellor, and also the other staff, so there's another 98, we already have 96 negative results back, which is fantastic. Of the guests that were on floor 1, so the guests that are there and the guests who have left, we are still getting results for those. I can say the 9 that are still on that floor and have had their time extended, they've all come back with negative results. So that's very reassuring that we have a large number of those close contacts, both from the Hotel Grand Chancellor and from the PA, they've all come back negative, which shows that the quick action of the doctor and also getting these results and taking the measures we have taken means that we are in a very good position going forward over the next couple of days that will hopefully see us be able to lift those restrictions around hospitals and aged care and disability centres, and also youth detention centres and correctional facilities be able to be lifted on Friday. Now, in relation to the hotel quarantine guests in Hotel Grand Chancellor that are not on floor 1, any of them who complete their normal 14 days will be able to be released as long as they get a negative test upon leaving. So that includes those who have had to stay beyond their 14 days, who are on any other floor other than floor 1. They will be able to leave from midday today if they have a negative result. Unfortunately, those on level 1, we are asking them to complete 14 days, irrespective of how many days they've done prior to that, 14 days from the 9th, just to be absolutely sure that there's no transmission. I also want to just say we're aware that with New South Wales cases, I'd ask anyone in Queensland who has travelled to New South Wales in recent days, please check out the New South Wales COVID website, have a look at the sites that they've listed to assess whether you have been there and whether you now need to follow the directions of the New South Wales government. So again, anyone who has recently come to Queensland and been in New South Wales, we please ask you to have a look at that. We are not making any decisions in relation to New South Wales at this stage based on the case they have, other than keeping a watching brief and asking anyone who's travelled to New South Wales to check that website and make sure that they are quarantining and getting tested if they've been to any of those sites, or of course if they're contacted by New South Wales Public Health Unit as contacts. There is another issue that has arisen, and that is that in relation to the AstraZeneca, we are seeing some people who have had severe allergic reactions or anaphylaxis in the past, that they are reacting to the AstraZeneca, and this issue is being raised at a national level. Dr Young and Dr Bennett are actually in Canberra today to talk more generally in relation to COVID and the vaccine, but they are raising this issue with their colleagues. But in the meantime, we are putting in place precautionary measures that anyone who's got a severe allergic reaction in the past to any sort of allergic reaction or anaphylaxis, that they delay getting the vaccine. Alternatively, we will be observing them for longer after their vaccination. In relation to the rest of the people who have not reported ever having a severe allergic reaction in the past. We will be making sure that we monitor them for half an hour now, just to be sure, while these discussions happen at a national level. I want to reassure people that we have absolute confidence in our vaccines in Australia. As the Therapeutic Goods Administration has said all along, that there is a risk category there in relation to people who have allergic reactions. We expected this, we are prepared for this, but we do want to make sure, because we are seeing a number of people react to the AstraZeneca, that we are letting people know about that and monitoring them for a longer period to make sure that everyone is safe.